Dementia is a collective term for a progressive neurodegenerative disease that is characterized by the clinical manifestations of deterioration of cognitive and memory function. Dementia is not a single disease itself, but more of a general term that covers a wide range of specific medical conditions for loss of memory, language and communication, problem solving, and cognition. It is estimated that by 2030, there will be 65.7 million people diagnosed with dementia. There are various types of dementia that have specific characteristics, including Alzheimer's, which is the most common form, occurring in 60 to 80% of those with dementia. Lewy body dementia, vascular dementia, frontotemporal dementia, and other disorders such as Parkinson's and Huntington's disease that can be associated with dementia, but this is the most rare form. One's daily living skills will progressively decline, along with a change in personality and behavior, such as abrupt mood changes, lack of empathy, repetitive or obsessive behavior, or impulsivity. Some early general symptoms of dementia may include difficulty performing tasks that were once easy, such as counting money or driving, getting lost on familiar routes, difficulty or decline with speech and language, for example, like finding the right word to use in a sentence. It may be hard for them to find that word. Losing interest in activities that you once liked, waking up during the night, so this messes with their sleep-wake cycle, and loss of social skills. More general symptoms that one with dementia may face are difficulty performing tasks like cooking food, forgetting past memories, having hallucinations, becoming depressed or agitated, and having difficulty with reading or writing. Mood swings are very common symptoms of those with dementia, where the person may become angry, anxious, or even violent. They also may have trouble following directions due to loss of memory. When communicating with someone who has dementia, they may struggle with many of the previous mentioned symptoms. It may be hard for the individual to process and comprehend what you are saying, and may have trouble communicating back to you due to forgetting what they're saying and thus losing their train of thought. For example, when they are speaking mid-sentence, they might lose their train of thought and thus abandon their utterance. People with dementia will most likely produce incohesive sentences, and this can result in changing topics often and eventually incoherent language, so you may not be able to understand them at all. They also may present with many nonverbal behaviors, such as not utilizing a variety of facial expressions, so they might just present with like a straight face and there's no variety of a facial expression. So they may not smile, they may not frown, not making eye contact, fidgeting, and change in posture. So posture shift when they're speaking with someone. They may turn their body to the side instead of facing their body towards the person speaking to them. People with dementia may speak with a monotone voice without varying their intonation, such as varying pitch during conversation. When initiating conversation with people with dementia, it is important to greet them by saying who you are, introducing the topic at hand before beginning conversation, and speaking to them in a manner that they will understand. Dementia is a debilitating disorder that often leaves a person with a loss of self, especially their identity, and completely changes who they are and who they once were. It is important to become aware of the symptoms of dementia and how to compensate or accommodate those when communicating with those with dementia. Connecting with the person and meeting them where they are at by helping validate their engagement and interaction is key. Making them feel wanted and heard is so important in communicating with someone diagnosed with dementia because it allows them to improve their lost sense of self. Thank you.